signs and symptoms like asthma, for example, like sinonasal polyps in the nose, in the sinuses. But if the immune system does not work properly, it can have very catastrophic consequences that even cause death in the patient. The body reaction to this fungus is usually a granulomatous reaction with central necrosis. The organs have characteristic septate. So the hypha are septate, acute angle branching hypha with 40 to 45 degrees based in a special staining glomerular methanoid silver or PAS, periodic acid sheath stain. Here you see an aspergilloma. This is a cell wall. You can see the fungal hypha, which is composed of septated hypha. They are septated hypha of the fungus with acute angles. If you see the angle between the hypha, it is less than 90 degrees and approximately 45 degrees. So it is an acute angle. Hypha, narrow septate here in hypha with acute angle is very suggestive for aspergillosis infection. Okay? In glomerular methanoid silver, they appear black. So you confirm the fungal nature of this disease. Protein, cholesterol, urate, and gout to avoid. Or exogenous like talc, suture material, parasites, oil droplets, wood metal, silica, silicone, and provoke chronic inflammation of the foreign body type giant cell reaction. The reaction provides a mechanism for elimination of the foreign body, and reaction is initially acute and gradually cause foreign body granuloma. Foreign body granuloma contains multinucleated giant cells with haphazardly arranged nuclei. These giant cells are fused macrophages and foreign body material, usually can be seen in their materials, in their cytoplasm. Here you see, this might be a tophi crystal or calcium deposit, which is surrounded by multinucleated giant cells. These giant cells, in contrast with the non-calcium horseshoe type giant cells, have a very haphazard and random arrangement of the nuclei. So if the nuclei have a haphazard arrangement, it is in favor of a foreign body type giant cell reaction, not tuberculosis. In tuberculosis, the nuclei are arranged in the periphery of the cells. They are very regular, semilunar appearance, horseshoe type, urogenic. When the nuclei are haphazard, and you see the evidence of foreign body type material, which can be endogenous or exogenous, it is called a foreign body type giant cell reaction. In our slide, there is a skin tissue with foreign body reaction to degenerated hair shaft. A disease, for example, in the barbers, is the pilonidal disease. When hair is inverted, pierces the skin and causes inflammation in subcutaneous tissue, the reaction of the body to this foreign material, which is hair shaft, is foreign body type giant cell reaction. Our slides are related to pilonidal disease. The inflammatory cells are mainly lymphocytes and macrophages. Things that you should view within your microscope is epithelial histiocytes are activated macrophages resembling epithelial cells, elongated with finely granular eosinophilic cytoplasm and central ovoid nucleus, oval or elongated. In prolonged situation, fibroblasts can be visible around the inflammatory cells infiltrates. Here you see skin tissue. This is epidermis. This is degenerated hair shaft. If you see your hair shaft, Your hair under the microscopy, it has this appearance. What is it? Intact, long, and slender. When it is degenerated, it is cut into pieces. It is cut into pieces and surrounded by granulation tissue and mixed inflammation. You see here degenerated hair shaft, presence of mixed inflammatory cells, namely lymphoblastic cells, and a foreign body type giant cell reaction, which is the characteristic morphologic appearance, the characteristic of the foreign body type giant cell, presence of foreign body material in the cytoplasm, and haphazard arrangement of the nuclei. So this is a foreign body type giant cell. Here you see giant cell surrounding the foreign hair shaft material, and also the nuclei arrangement is not very regular throughout the periphery of the cell. So the haphazard arrangement of the nuclei aid you in diagnosis of the foreign body type giant cell. Here you see another view of that slide. You see here the foreign body type giant cell, foreign body type giant cell, a vacuole probably containing foreign material, and also haphazard arrangement of the nuclei. Here, what are these materials? Degenerated hair shaft. What is this? Foreign body type giant cell. What is this? Foreign body type giant cell. Foreign body type giant cell. Foreign body type giant cell. Yes. Here is the degenerated hair shaft, foreign body type giant cell, degenerated hair shaft, foreign body type giant cell. Here you see degenerated hair shaft, mixed inflammatory cells, lymphoblastic cells, degenerated hair shaft, degenerated hair shaft. Any question? Review